Hello guys, my name is Christopher South and I'm a paramedic with West River Health Services right here in Hettinger, North Dakota. And today what I want to talk to you about is stroke. Um, Unfortunately, stroke affects millions of Americans each year. But the thing is, guys, early recognition has a huge impact on the outcome of that patient. So the earlier we recognize the symptoms, the quicker we get a response, and we can get a patient to an emergency center so they can have a CT scan done and appropriate treatment. So the quicker we find out what's going on, the faster the response, the better the outcome. And the reason we're doing this today is that early recognition starts right there at home with you. So we're going to talk a little about stroke today. So what is a stroke exactly? Well, there's basically two types. The first is known as an ischemic stroke, and about a little greater than 88% of all strokes are ischemic strokes. And what happens is blood flow is occluded, usually by a piece of plaque or something like that, to a section of the brain, and because it's occluded, oxygen and blood and those kind of things are not getting to it, and that area is affected and it starts to die, and the patient can start having symptoms. The other one, which is less common, is a bleed. That's actually where one of the vessels or whatever actually opens up and allows blood to escape, and that's known as a hemorrhagic stroke. The things I want you to understand is stroke symptoms are sudden. They just come out of nowhere and just hit you. They are sudden onset events. These are not something that gradually come on. These are something that come directly out of nowhere and just affects that person. So some of the things that I want to talk to you about is something that we're changing over to, which is known as BFAST. So BFAST is what we're going to talk about a lot today. And the first thing, and we're talking about BFAST, is the letter B, and that's going to stand for balance. So a sudden onset where a person is having difficulty with balance, where they can't keep their gait, they feel like they're drunk or they're dizzy or anything, could absolutely be a sign of stroke. Strokes that happen in that area are called cerebellar strokes, and about 50% of them are missed by providers because we don't see those sudden onset signs and think of it as stroke. But guys, if you're having sudden onset of balance problems, call us up. Let us check you out. The next thing is E for eyes on our BFAS. And so if you have a sudden loss of vision or blurry vision or anything like that, it could indicate a stroke, and we need to have it checked out. Anything that's sudden onset that hits you, it's always better to be checked out than not to be checked out if it is a stroke and you have some deficits that could be pretty severe later on. The next thing is very common, everybody knows, is F, which is for face. And what we're looking for is to see if one side of the face may be drawn down on one side. I can't really do it so much with my face. But a good way to see if somebody is having difficulty with their face is get them to smile for you. Big old toothy grin. And we should see that everything is the same on both sides. If one side is drawn down, that's a big, huge indicator for stroke. The next thing is arms, all right? If somebody has a sudden loss where they can't use one of their arms or anything, it's a significant sign for stroke. So as providers, one of the tools that we can do is we can get a patient to hold their arms up and get them to close their eyes, and if one arm starts to drift or the other starts to drift, we know that that could be a sign of a stroke. Next thing is S for speech. And what we're looking for here is a sudden onset where the patient has either difficulty talking or the things that they are saying are confused, don't make much sense, it just comes on all of a sudden. So one of the things that we as providers do is we try to get that person to repeat a saying back to us. And one of the ones that I use is, you can't teach an old dog new tricks. And I hope that when I say that, that patient can repeat that back to me and their speech and everything be exactly the way I said it. Maybe not with my southern accent, but to make sure that they say it pretty well the same way I said it. If there's anything that's wrong with there, could indicate a stroke. And the last and certainly the most important thing that I need you to understand is T for time. When you call, we need to know exactly what time those symptoms came about, what time they started, because depending on that time gives us a time frame on what kind of treatment options that we have. The quicker that you recognize a stroke, the quicker we get a response to an ambulance, you can be able to go in there and take care of things, and the quicker we can get to a hospital to get that CT scan done, the better the outcome. So guys, what I want you to remember all back home is real simple. If you think you're having a stroke, call us. Our number is real simple. It's 911. We'll be on the way very, very quickly. Remember those things that I teach you today. Be fast. All right? So B is for balance. Sudden onset of, not being able to balance yourself. E for eyes, vision problems. F for face. One side of their face doesn't look the same. It's not symmetrical. A is for arms, all right? If they're either arms or their legs, it's got a sudden onset where they can't utilize it anymore. S is for speech, how they talk and the way that they communicate has changed. And most importantly on our be fast is I want you to be fast with that time. As soon as you recognize those symptoms, you call us and we will be out there. We want to transport you to the facility that can take care of you. And I want to remind everybody that right here in Hettinger, we have a CT scanner and we are a stroke-ready facility and we are ready for you. So guys, thank you so much. We're going to be producing a lot of these videos and get some information out there to you. So be fast. Call us if you need us. Thank you. Bye-bye.